It's Krista reporting live from Station 213. A report just came in this morning that Dalhousie occupational therapy student discovered an assessment called the Functional Independence Measure, also known as the FIM. The Functional Independence Measure is an assessment that has been developed as a measurement of disability for a variety of populations and is not specific to any diagnosis. Occupational therapists measure this through activities of daily living. I am reporting live with more information here at the station. Joining me soon will be an occupational therapy student named Ashley. She can tell us more about this new discovery of this assessment. All right, and joining us here today is Ashley. Ashley is a first-year occupational therapy student at Dalhousie University, and she's here to fill us in on some of the findings about the new occupational therapy assessment. We're pleased to have you and appreciate your time today and joining us. Thanks for coming.
Yeah, thanks for having me.
Yeah. So Ashley, I'd just like to start and ask you if you could tell us a little bit more about this new assessment.
Yeah, so the assessment, like you said, it's called the Functional Independence Measure, also known as the FIM for short. Is primarily informed by the need for a standardized and comprehensive tool that will measure disability and rehabilitation outcomes in a wide variety of patients. So standardized scores are very helpful because they allow for consistent and comparable measures across different healthcare providers and settings. Specifically designed to be a quick and uniform assessment. It's used in rehabilitation settings so that clinicians could track functional changes in a patient's rehabilitation process and inform their interventions that they might use with the patient. It tracks patients from beginning of care to discharge and all the way through follow-up. The FIM is a measure of disability and not impairment. It's intended to measure what the person is able to do or perform, not what they could do or might be able to do in the future.
All right, thank you, Ashley. So I just want to clarify for the viewers, it is used by occupational therapists to assess and grade the functional status and independence of a person based on the level of assistance required by the individual?
Yeah, exactly.
Oh, awesome. All right, so Ashley, I just love if you told us a little bit more about this assessment.
Yeah, so there's 18 different items that the scoring is assessed on, and they're basically split up into motor and cognitive domains.
All right, so tell us a little bit more. You mentioned motor and cognitive domains. How are these functions being assessed?
Yeah, so there's different categories. You can kind of see behind us here. They're split up into self-care, sphincter control, mobility/transfers, locomotion, communication, and social cognition.
Okay, great. That's very clear. Thank you. So now how are these translated into a standardized measure?
Great question. So scores must be obtained by a trained individual, and there's a couple of different ways that scores can be obtained. So it can be through client interviews, it can be over the phone or in-person interviews, client observation, and also through looking at client medical records.
Okay.
And so scores are ranging from 1 to 7. So as you can see here again, a score of 1 would mean that the patient needs total assistance, and a score of 7 would mean complete independence. And so that range from 1 to 7 is kind of like a spectrum, as you can see here, with the different levels of assistance required in relation to ADLs. So those scores will then be all gathered into one total score, which will indicate to professionals where their client is on that spectrum, again, with one side being complete independence and the other side being complete dependence.
Perfect. Thanks, Ashley.
Yeah.
So it sounds like you're collecting a lot of information during these assessments. How long would these assessments take with a client?
Generally 30 to 45 minutes to administer.
Okay. And why are occupational therapists using this standardized assessment?
Yeah, so as I kind of touched on earlier, the assessment can be used to inform rehabilitation and medical interventions.
Okay.
It can also provide us with a baseline measure of a client, meaning that we can reassess using the FIM to see if any changes have occurred. So for example, research in stroke patients showed that reevaluations can improve cognitive and physical recovery. So that reevaluation is really helpful. You may also be wondering what that kind of means in terms of occupations. And while there are a few occupational implications. So as we know, the FIM helps determine the level of assistance that one needs to perform their meaningful activities of daily living. And just to put it into perspective, I'll give you a bit of an example. So let's say an individual had difficulties and they have difficulties with eating and they have a score of a level 5 on the FIM. That would basically tell us that they would benefit from supervision, such as somebody standing to cue or helping them when needed. So this could mean that they might also benefit from applications of adaptive devices. And basically, during the task of eating, help from another person might be required to do things like open a container or butter bread or cut meat or even pour liquids.
Okay.
Yeah. In terms of intervention planning,
Yeah.
the FIM can evaluate effectiveness of interventions. So this is useful because it can show if an intervention is helping a patient along with their progress. It might also let the clinician know that interventions are not but well suited to their client, and so that can kind of tell us if the client might benefit from a new approach, so we might need to take a step back and reevaluate. Lastly, this tool can show us what level of assistance the patient requires, so that can help us avoid excessive amounts of assistance from being used. So to sum it up, basically the FIM helps healthcare providers select interventions. For example, you might be deciding between a compensation approach or a remediation approach.
Yeah, that's great. Thanks for joining us, Ashley. You gave us a lot of great insight. And stay tuned, viewers. We'll be having Sandra join us next, who is an expert in the field. We're back reporting live from Station 213. Now we have with us Sandra. Sandra is a well-established occupational therapist who works in the field of rehabilitation. Sandra has used this assessment many times. Sandra, our listeners want to know how reliable this assessment is.
Of course. Well, first, thank you for having me here today. So as we know, the FIM is a widely researched and standardized tool for measuring disability based on the International Classification of Functioning. So it's used to evaluate the effectiveness of ongoing therapy, the progress of rehabilitation, and to estimate the length of a hospital stay. It's important to note that it is not possible to capture all data and all psychometric measures for the FIM, as it's a widely used tool amongst many professions and populations. So with that being said, we're going to focus on the use of the FIM in a geriatric rehabilitation, more specifically, a comparative review looking at the reliability and validity of the use of the FIM in the functional assessment of older adults. As you can see here, this is the article that we're going to base off these results from. So the study population consisted of individuals aged 55 years and older, focusing on articles that discuss the development and measurement of properties of the FIM. So results indicated that the internal consistency, so that measures the average correlation between all the items on the FIM, had a total score of alpha is 0.88 to 0.97. So that might not mean much to you guys, but an alpha score of 0.8 and above, it means it's indicative of a high internal consistency, even more so than other assessment tools, which is great for the FIM. Two articles explored inter-rater reliability. This assesses a tool's stability over time when used by the same rater. So a rater can be defined as the professional clinician who is administering the FIM. So the findings highlighted a strong inter-rater reliability with a total score of R is equal to 0.95, averaging to 0.98. And these findings can be highlighted just up on the board here above. So in addition, 5 articles examined inter-rater reliability, so the consistency of results when different raters are administering the FIM, and consistently demonstrated that the FIM is a reliable instrument with a total score of 0.8 to 0.99 when used by various raters. In conclusion, consistent findings across many studies indicate that the FIM demonstrates substantial evidence of high reliability in geriatric inpatient rehabilitation settings.
Wow, Sandra, it seems like you really know your stuff. That was a lot of great information. Would you mind just simplifying it for our listeners?
Absolutely, I know that was a lot. So basically, the FIM is a reliable and well-known assessment.
Awesome, thank you.
No problem.
So now we know it's reliable, but how do we know about its validity and its responsiveness?
That's a great question. So what I'm going to do now is I'm just going to put some of the information that we gathered from the article up on the board. So regarding responsiveness, the evidence supports that the FIM can effectively track changes during inpatient rehabilitation over time for older adults. So now moving on to validity. Validity refers to whether the FIM accurately measures what is intended to measure. So during its development and early implementation in multiple inpatient rehabilitation settings, the FIM was examined for face validity by a diverse group of raters. As we talked about earlier, this can include occupational therapists, physiotherapists, nurses, doctor, and many more. Revisions based on their feedback affirm the FIM's final form is a valid measure of disability amongst many healthcare providers. So 4 articles investigated predictive criterion validity. This is determining whether the FIM can be used to predict future outcomes. It was determined that the FIM can predict level of care and can consistently predict discharge location, length of stay, and discharge function for inpatient rehabilitation settings. Concurrent validity was measured, and it was found that caregivers of home care patients can accurately report FIM items using alternative methods of FIM administrations, such as patient or nurse interviews to guide patient observations in neuro-rehabilitation settings.
Wow, thanks, Sandra. So now that we know that it's reliable and it's a valid assessment, who would we use this assessment with?
That's a great question. So the FIM can be used with a variety of populations, including stroke patients, brain dysfunction, neurological conditions, spinal cord injuries, geriatric rehabilitation, pain syndrome, orthopedic conditions, and many, many more.
Thank you so much, Sandra. You are definitely the expert in the field, and our listeners are eager to find out what are some of the strengths and limitations of this assessment, as well as what makes this assessment useful or not useful in a clinical setting.
Those are all some great questions, Krista. Thank you. And I wouldn't say I'm the expert, but I will provide a little bit of strengths and limitations to this assessment. So a limitation of the FIM is that the scoring may be interpreted across different countries, suggesting that the tool may not be inclusive to all cultures. The occupations ADLs on the FIM may not be applicable to everyone, so that's definitely something we want to keep in mind in a clinical practice. Another limitation is that the FIM has been found to discriminate patients based on their age. However, through the years, we have developed the FIM. So this is designed for children for a more accurate measure of their occupations. Additionally, it may discriminate against discharge destinations, so it's important to consider the environment your client is going into post-discharge. But here are some strengths. So a strength of the functional independence measure is that scores at admission predict scores at discharge. These scores can be used to support rehabilitation programs, as well as educate the patient and the family about the possibility of progressions and determine the amount of care given in the home or discharge placement. But what we really want to focus on about the strengths of the FIM is that the FIM provides us with the information to provide interventions and tools for clients to participate in the occupations that are most meaningful to them. And that's something as an OT that we really want to provide for our clients.
Yeah, thank you so much, Sandra.
Absolutely.
So I'd just like to do a little recap of the things we learned both with our student Ashley as well as you, the expert. So the FIM is applicable across various patient populations and evaluates both motor and cognitive function across 18 items. So the scoring ranges from 1, which is totally dependent, to 7, which is totally independent. With this assessment taking about 30 to 45 minutes to administer. The FIM is valued in rehabilitation clinical settings, and we can also see that it has high reliability and validity. As well as, despite a few limitations, the FIM remains a widely used and trusted assessment in clinical settings, helping occupational therapists determine the appropriate level of care and measure rehabilitation outcomes. Does that sound pretty consistent with your knowledge?
Absolutely. Well done.
Thank you. Thanks for joining us today. So we'd love if you just stayed on the line. We have a small gift for you. And we're going to now join Ashley, and you'll get to see a small clip of this assessment being performed.
Thanks, Krista. So now we're here at the School of Occupational Therapy at Dalhousie University, where Sandra is going to join me in a minute, where I will run through a quick demonstration of what the functional independence measure might look like in real practice. Hey, Sandra.
Hi, Ashley.
So today I'm going to be your student occupational therapist working with you, and I would like to do an observation of how you dress your upper extremities. And what I was thinking is that you could place your cardigan on just as you normally would, and I will be observing while you do that. Is that okay with you?
Absolutely.
Okay, perfect. And while Sandra is placing the cardigan on her upper extremities, I will be looking out for any limitations or challenges that she may be experiencing as she dresses. Okay, so now I'm going to have you place that cardigan on while I observe. So notice that you're primarily using that left hand to place the sleeves on your right arm. Is that something that feels more comfortable?
Yes, I'm having difficulties lifting my arm.
Yeah. And similar with the buttons, would it be uncomfortable for you to use your right arm when buttoning?
It would be, yeah. And my right arm's my dominant hand, so I've been struggling trying to...
Challenges with the left?
Yeah.
So overall, some of my observations, I noticed you got the task done, you have your cardigan on. With your left side, things were a little bit easier. You got the sleeve on, no problem. With your right side, it seemed a little more challenging. And then same thing when it came to the buttons. It was a little bit easier to just complete that task with your left hand as opposed to the right hand. And just with these comparisons from right to left side, I imagine that this task has been taking you a little bit longer than what might be normal for yourself. Would you agree with that?
I would. It has been taking me a little longer to get dressed.
Yeah. So now I'll be going through how I would score Sandra's example. So what's really helpful about the FIM is that for every item, it has a little flow chart of how the item would be scored, and it kind of helps to direct what score between a 1 to a 7 you would give. So the first question, you'd start here, is does the subject need help when dressing above the waist? So I would say in Sandra's case, the answer to that would be no. Sandra was able to complete the task and did not need any assistance. The next question, before we decide between the score of a 6 or a 7, is does the subject need an assistive device for upper body dressing, such as a button, hook, Velcro, or reacher? Or do they take more than the reasonable amount of time to dress the upper body, or is there concern for safety when they dress? So I would say there's no concern for safety. However, it did take Sandra more than a reasonable amount of time to put on the cardigan, and the patient could also benefit from an assistive device. So in Sandra's case, I would say Velcro or buttons that snap into place. So the answer to this question would be yes. That would give us a score of 6, which indicates modified independence. Now over here, we can go to this page. We can see the score of 6, modified independence. This page basically just has some more detailed information on the level of assistance that would be required depending on the final score. And I would say that this accurately lines up with Sandra's result, as Sandra was still able to do the task, but could benefit from modifications.
Thanks for tuning in to Station 213 with Krista. I hope you found this episode very educational, because I definitely did, and we'll see you next time. Stay tuned for our next breaking news about a heartfelt story about a cat being rescued by a crew of firefighters.